For starters, the biggest thing that you gotta have going into clinic rotations is confidence. And the reason why I say that is because that's almost half the battle. What's going on, fam? Hope y'all are staying safe, doing well, and grinding towards your goals, staying hungry, because you know what time it is? It's time to eat. Let's get it.
I gotta hit the beat. I gotta hit the beat. I gotta hit the
All right, so today we're going to be talking about how to transition from didactic year into clinical year. And especially when you're starting out clinical year, it's going to be a scary ride, but you're going to be more than prepared. You just got to trust yourself, trust the process. And, I'm excited for y'all. Let me know what your first rotation is, and hopefully I can help answer some of your questions and alleviate some of that anxiety going into rotations, and also share some resources that I picked up along the way. And speaking of resources, shout outs to Bree. I'm gonna post the link for the end of rotation exam study guides that she has in the description below. Shout outs to Smarty Pants, shout outs to Rosh. So definitely check out those resources as well to help get you through clinical year. So without further ado, I'm gonna go ahead and talk about how to prepare for clinical year. The biggest thing that you gotta have going into clinic rotations is confidence. And the reason why I say that is because that's almost half the battle with the preceptors and also with the patients, especially with the patients, because you're going to be going in and introducing yourself. We kind of have like a double whammy, right? So we go in introducing ourselves as a PA student. Most of the time they don't even want to see a student, and then some, add on to the fact that sometimes people don't want to see a PA and they want to see the doctor and whatnot. So that's why it's kind of like a bigger challenge. But at the same time, I would say I probably had maybe 2 or 3 patients in my whole clinical experience that were like, no, I don't want to see a PA student. I would say, yeah, the confidence right off the bat, you gotta just trust that you know what you're capable of, and you know that you also have kind of a fallback in terms of your preceptor. So all of that information, you were taught all of it during didactic year, and even if you don't know it, you're going to be looking it up and whatnot. And each week that goes by, each patient encounter that goes by, you're going to get better. So from the first patient encounter to the very last patient encounter that you're going to have during rotations, it's going to be like a day and night difference, right? And especially when you go into presenting your case to your preceptor, pretty much, you build that confidence in order to present correctly or fluidly, and second, you have that confidence in your treatment plan, especially if your preceptor is asking you, all right, so what do you think they have, what do you want to do with it? And so with presenting, a lot of preceptors are different. Some preceptors are like, all right, just tell me what's going on, tell me what you want to do. Some preceptors want you to give the full-on history, like surgical history, past medical history, medications, everything, the whole shebang. And it's good practice to do it that way, and you'd rather start off presenting that way and then having your preceptor tell you like, hey, no, just tell me what's going on and stuff like that, because you don't want to waste your time, but at the same time you don't want to start off showing that you're kind of like lazy or taking the shortcut, you know what I mean? Definitely practice the presentations, the full comprehensive presentation. It's okay to jot down your notes and stuff like that. I went in with my iPad, so shout outs to my iPad and that Good Notes app, because all my like didactic notes were in there, my templates for my H&P were in there. With that, I was able to jot down notes or put down my physical exam findings and stuff like that. So that way I can like present while remembering the patient, but at the same time I had my notes to look at in case I needed it. The cases that you don't know, or like treatments that you don't know, look it up like as soon as you can. I used like Up to Date or Hippocrates on my phone. If you're on the computer, Google it and stuff like that, and check out reputable sites that have all that information, again, like Up to Date and stuff. And and current, of course. And then, so utilizing those tools, especially like early on, will definitely help solidify it, because you go from seeing the patient, you have like that patient demographic in your mind, you have what they presented with, what signs and symptoms, what the history of it and stuff like that. So you have your vignette already, quote unquote, right? And then you have your like idea of what you want to do to treat, and then once you look it up, then that you can confirm this is the antibiotic that I want to give them for this bacterial infection. This is the medication I want to give them for their hypertension management, for their diabetes management, whatever it may be. And then you on top of that, you're getting that reinforcement from your preceptor and them teaching you all of these things and how they practice medicine. And I'm gonna say, like, the tricky thing about like being out on rotations, and then when you get your end of rotation exams or when you're restudying for the PANCE, is that oftentimes clinical medicine and textbook medicine don't line up. And so I know it's pretty tricky in terms of like, all right, you got to realize, okay, this provider's been practicing this way for a long time. This is the way that they've been doing it. This is their evidence-based medicine, because they haven't never had any issues with it, even though the guidelines might change or you might learn something different in textbooks. So with that, you just kind of have to learn from them during that rotation, the way that they practice. But at the same time, you also have to kind of unlearn it and relearn the textbook way, the guideline way, the standard of care way, when it comes to the end of rotation exams and for the PANCE. And so with the end of rotation exams, biggest thing is you got to start studying like from the jump. Those exams weren't a joke. Some of those questions were super easy, but then there were often times where it's just like, what the heck? What are you even asking? Like, where did this come from? So it's like another layer, another level of thinking. A lot of things such as, associated risk factors or second line treatment or like contraindications to a certain medication. You have to give them something else. I stuck with Bree's end of rotation exam study guides. I would definitely base my studying off of that. And then again, for more in-depth disease or pathology, I would look into current, because that one is like super golden in terms of giving you the real textbook medicine, aspect of it, instead of just like the bullet points and stuff. So go into that for more comprehension. But yeah, Bree's study guide was clutch, so shout outs to Bree for that. And then in terms of like practice questions, if you have Rosh Review, they have the boost exams. They have an end of rotation exam for all the specialties. I believe they're $20 to $30 per exam. I'm pretty sure $30 per exam. I thought it was well worth it, and it was good practice. And especially if you're, for example, like for us, we had 2 family medicine end of rotation exams, so being able to practice it for those 2 was helpful. So Smarty Pants is another platform that you can utilize to study from. They break it down in terms of the guidelines and the blueprint, right, of each end of rotation exam, and they have all of those diseases on there. They have all the signs and symptoms, physical exam findings, diagnostics, treatment, and stuff like that. So it's pretty organized in the sense that all that information is already there. Again, if you want to go into more depth, use current, use up to date, and stuff like that. And again, they have practice problems that you can do, practice questions based on each rotation. And along with that, I mean, I know a lot of people say clinical year's the more fun year, and you're not studying as much and stuff like that, which is true because you're super tired. But at the same time, still, you can't slack off on the studying for sure. Another thing that I would recommend is like if you have PANCE Prep Pearls, right? So open up, to, let's say, I don't know, dacrocystitis for in current, and then open it up to where it is in pants, and go through and read it and write down the notes that it's missing in pants part pearls, and whatever you read in current that's relevant, because you don't want to go into too much depth, but at the same time it's good to know some of that information as well. It's just you got to try to be efficient, because especially during rotations, like, you're going to be so tired, and you're not going to want to do extra studying, you're not going to want to do extra work, but it'll be worth it. And I think the more you put into the rotation, the more you're going to get out of it in terms of value with your preceptor. You can potentially get a job offer and stuff like that. So I would highly recommend going that route. So if you are commuting, highly recommend getting like podcasts to listen to, or reviews, board review audio to listen to, because again, you got to just try to be as efficient as you can. So the last thing I wanted to talk about was kind of just like a miscellaneous thing in terms of rotations. So first and foremost, like, be nice to literally everybody that you meet, all the MAs, all the nurses, all the staff, the doctors, the nurses, NPs, PAs that you run into, that you're rotating with. Always be able and willing and ready to learn from them. You never know what opportunity is going to come up with them. So I highly recommend just being like, yeah, I'm down to do, X, Y, and Z. I'm down to see X, Y, and Z patients. Whenever they ask you, like, oh, have you ever done this before? Just be like, no, I haven't. Yeah, can you teach me? Can you show me? So the next time I'm able to do it. There were a lot of procedures that I was able to do after the first time around, but at the same time missed out on like a couple of different ones when I wasn't necessarily like ready to do them. So I would say this is like your opportunity to learn, and this is the opportunity to sharpen your skills and improve your skills and stuff. So just got to be confident, and got to be like ready to take on whatever challenges or opportunities arise, especially during rotations. Lastly, I was always taught to kind of like always take care of your MAs and nurses. That way they can take care of you, especially as a provider. Because if you butt heads with them, or you don't get along with them, or you mistreat them, you're not going to be able to get any work done in terms of orders or different things that you want for the patient and stuff like that. So what I always did every rotation was like try to bring a box of donuts for the staff, and then afterwards write a little thank you card, if not get a gift or something like that. So there were a few MAs that like I really connected with, that were like, we still keep in contact, and they're super cool. A few of my preceptors are, I still keep in contact with them, and they're texting me and sending me potential job offers and stuff like that, or checking up on me. So it's really good to build that connection, and you never know down the line when you're gonna need those connections. But other than that, I mean, just you made it this far, what you got to do. Just always keep growing, always use each opportunity to learn as much as you can and grow, and just become a better PA one day. All right, y'all, I hope y'all enjoyed this video, and if you did, go ahead and give this video a thumbs up, smash that like button. It helps with the YouTube algorithm, it helps make our channel grow, and it's free 99. If y'all have any questions, make sure you're commenting down below, make sure you're shooting them in the DMs, whatever it is, we'd love to help. If you're new to this channel, make sure you're subscribed, make sure you're turning on that notification bell, because we're dropping content left and right, and we want to help as many people as we can. So without y'all, we can't do that. Lastly, hope y'all are staying safe, doing well, grinding towards your goals, keep hustling towards your dreams. And you know what? I'm about to make like a ball and bounce. Peace.